Hi, this is Farouk Alemi. I would like to tell you a brief story about how a critical access organization has improved patient experiences. This presentation describes how Southern Humboldt Community Healthcare District, which includes both the clinic and the Gerald Phelps Community Hospital, improved patient satisfaction. The Gerald Phelps Community Hospital is one of 32 critical access hospitals in California. It's located in Garberville, a very charming small town with a main street with restored shops fronts and restaurants. A quiet place that's not always on forefront of change and innovation. Extraordinary things are happening in this rural community. There is a lot going on here, from new technology to better finances to culture of dedication to patients to quality awards from California Hospital Association and so on. It's a long list of recent achievements. I'm here to tell you a small part of the transformation that has taken place. I'm here to tell you how they improved patient satisfaction. It's not easy to improve patient satisfaction. CMS has asked acute care hospitals to conduct CAF surveys. This is required by urban hospitals and optional to rural hospitals. CAFS is a 27-item survey of a randomized sample of patients that takes a long time to collect, almost a year, and has irritated both hospital administrators and patients. No one wants to fill them, forcing hospitals to hire firms to call patients and remind them to complete the surveys. Sometimes patients have to be called up to 5 times to remind them to complete the survey. The data are available after long delays. Lots of data are collected, reams of reports are prepared, which sit on the manager's desk and do not lead to real and lasting improvements. A lot of effort goes into measurement and very little into actually improving. We set out to reinvent the satisfaction surveys, to make it more efficient, more flexible. We did not want to lead the client to specific answers. We decided to use the shortest possible survey. We asked just one question. This is an open-ended question. It allows us to capture the client's views in their own voice. We do not need to reformulate it or force the responses through preset menus of options. The patient says what he wants and in words he wants to say. We just ask what works well and what needs improvement. We can collect information through personal interviews, from web comments, from complaints to risk management department, through emails, kiosks, IVR phone calls, postcards, and comment cards. Early on, Southern Humboldt Community Healthcare District decided to focus on comment cards and kiosks at strategic locations. Here you see the back of the comment card that patients use. This is the front. Patients can leave the cards in comment boxes or stamp and mail them. Here is an example complaint that was posted. Here the patient is talking about how the doctor makes him or her feel put off. The patient wants to be taken seriously. This complaint points to a problem in the relationship or empathy between the clinician and the patient. Here is an example of a positive comment. The patient's words such as amazing, beyond helpful, friendly, and happy communicate that this is a positive comment. We use sentiment analysis to classify comments into positive or negative comments. This is a patent-pending artificial intelligence process that classifies sentences based on the keywords and their context. We also classify the topic into whether it was about waiting time, physician issues, nursing issues, staff issues, cost of care, facility issues, privacy, and other topics similar to this. This allows further analysis of the data. Here are some examples of words used in the complaints received early on about a year ago. Here are examples of words used more recently, reflecting a shift in the content of the comments. To provide managers with quantitative benchmarks, we examine time to next complaint. One would expect that over time fewer and fewer complaints are seen. Here we see consecutive complaints increased around the 25th day. When consecutive complaints go beyond the control limit, then an email is sent to the manager alerting him or her to potential adverse events. Managers are also provided with benchmark comparisons showing how they stack up against other units within the organization. Here the ER is doing worse than the clinic. The data are analyzed by the computer. Reports and graphs are also written by the computer. And as a consequence, the analysis is available in real time when the manager wants to examine the data. As new comments come in, the analysis and the reports change. This enables improvement teams to make changes and track their impact. It allows employees to make changes and see how it's affecting their performance. For example, the receptionist can see if changes in her or his interactions with the patient has led to more praise and fewer complaints. This graph shows complaints and praises over the last 500 comments received within the Southern Humboldt's clinic. On the x-axis is time, and on the y-axis we see number of comments. Green shows positive and red shows negative comments. So at start there were 77 comments, of which 13 were complaints. That's a rate of 16%. In the next time period, the number of comments declined to 38, of which 9 were complaints. This is a rate of 23%. In the next set of time periods, we see the number of comments climbing to 103, of which 15 were complaints, a rate of 15%. Then we see a period in which the clinic ran out of comment cards and the number of comments declined to a low of 17. Finally, more recently, we see the number of positive comments increasing and the number of negative comments staying low. Look at all the red on the left and the lack of red on the right side of the graph. The rate of complaints declined from starting values of 16% of comments to recent values of 3%. We have seen a measurable and statistically significant improvement in patient experiences at the Southern Humboldt District over time. This has been made possible by the great people who work at Southern Humboldt. What we have contributed are analytics and business intelligence that engages every employee in making change. We have designed a process that costs a fraction of standard CAF surveys. Its reports are in real time when data and information matter. It's less biased than asking patients to answer preset leading questions. It's something else when you get feedback in the customer's words than some standardized questionnaire menu and some statistics. We have been delighted to help Southern Humboldt Health District. Urban healthcare organizations have a lot to learn from this critical access hospital. It's not just measurement that made the difference. They have been able to engage their staff in improvement efforts. They have a culture of quality that focuses on patient experiences. I've been in many organizations who want to improve their patient experiences. It's rare to see real, lasting, large-scale change. Most try, but few succeed. Southern Humboldt is succeeding. Its patients are having more positive experiences. At the end of the day, that's what really matters.